This is the Super Morning Show live on Joy 99.7 FM. My name is Kojo Akoto Boateng, and it's time for episode 2 of our Cancer Awareness Month. And today we'll be talking about investigative tools for cancer diagnosis. Basically, how do doctors and healthcare professionals get to know you have cancer so that they can treat cancer for you? How do you get to find out if you have it or not? That's what we'll be talking about this morning. It's a build up from yesterday's conversation, which was the first episode with Professor Kojo Akoto from the University of Cape Coast on understanding what cancers are, the various types of cancers, who is at risk, and what we must do basically to prevent them. Now, today I have one of the very experienced radiologists in the country, and she'll be giving us and sharing some knowledge with us as to how cancer is diagnosed to enable doctors and healthcare professionals to treat it. And so our guest is Dr. Albertina Williams. She's a consultant radiologist, woman breast cancer imaging specialist. She's a breast interventionist, and she's with BME Diagnostics and Healthcare. And she joins us today on the conversation on the Cancer Awareness Month. Doc, welcome to the Cancer Awareness Month. I hope you are well.
Thank you, Kojo. I'm very well, thank you. How are you doing too?
I'm also doing very well. It's a month to talk about one of the things that a lot of us fear. I remember when we were kids growing up in Kumasi, if you heard somebody had cancer, we will just then assume that the person was already dead and gone. If family said somebody had any form of cancer, they will start preparations for the person's funeral. But after
Like that sentence.
yes, but after the conversations we are having on cancer, I'm learning different things about it, and I'm a bit more hopeful that one, we can prevent them, and if you are even unable to prevent them, we can diagnose them early and treat them. And I think that one of the key processes in fighting cancers is diagnosing them, and then we treat them. So tell me a bit about yourself. You are a consultant radiologist. When we say somebody is a consultant radiologist, what does a person do?
Okay, so a radiologist is a medical doctor that has specialized in being able to detect diseases in the body as it is using machines without opening up the body. So that's what radiologists do. If somebody gets a stroke and they want to tell whether it's a hemorrhagic or infarctive stroke, if somebody has a disease in the spine, so CT scans, MRI, PET CTs, ultrasound, X-rays, and then there are, in fact, radiology is involving, there are different aspects of it that are coming. But most of what I do is with women and then breast imaging.
So for what you do, can I describe it as non-invasive?
Yes. So the difference between us and pathologists is that they would like a piece of the body or the body itself where the person has passed on. But we are able to detect pathology whilst the person is alive using machines.
You earlier said if somebody has a stroke, hemorrhagic stroke, and you use another term. When we say something, you say a hemorrhagic stroke. What is it?
Hemorrhagic strokes are strokes that the blood vessels had burst and then there's bleeding into the brain.
Okay.
Or if the blood vessel has been blocked. So we are able to tell things that are happening in the body by using machines.
Okay. So in this case, you, the consultant,
We are doctors for doctors.
you are doctors for doctors.
Yes.
Wow. Wow. So you can see whatever is happening in the body, and based on your
Using
results,
Yes.
based on the results, other doctors and other consultants can then
Can know
decide on the next course of action.
and then sometimes what we also do is to discuss treatment options or approaches. Sometimes the surgeon can ask, do you think I should go this way or that way? So we look at the images to decide that for them.
Great. Now let's come to cancer. We've learned a lot about cancers in the first episode, the various types and all those things. So, and when it comes to cancers, we are all afraid of it. Even the thought of going to tests or get screened or find out whether you have it or not, a lot of people are afraid of it. But we need you to help us go through this process. So, how do you do diagnosis for cancers? What different techniques are there? How do you investigate our bodies to know that somebody has cancer or may get cancer?
Okay. When it comes to breast cancer, what we use are mammograms, breast ultrasound, and then breast MRI, which is magnetic resonance imaging, to be able to detect if somebody has cancer or not. When it comes to breast cancer screening, mammogram and ultrasound is the best anyone can do for themselves. It's way superior than somebody going to have a clinical breast exam, which Ghanaians are terming breast screening, but it's not really breast screening, because these are able to pick up cancers 2 to 3 years before anyone can feel, any doctor or nurse or the patients themselves will be able to feel it with their fingers. So if you really want breast cancer screening, you have to go for mammogram and ultrasound. Then we rarely do the magnetic resonance imaging breast, which is the breast MRI, for those that have lesions that are indeterminate or ones that have very high family history, and we want to be able to pick up the cancers even just at the time they start developing. So if it's 2 cm or 2 millimeters or 3 millimeters, as small as it is, we want to be able to catch those.
Doc, before I let you go ahead, I need you to break down some of the terms for me. For example, you said if somebody has lesions that are indeterminate, what is that?
So sometimes you can have a mass in the breast that is having some features of it being benign and another feature of it, maybe just one of it being malignant. But we want to be very sure of what it is, especially in those that have positive family history of breast cancers. And you don't want to miss those to chance. Then we go on and do breast MRIs for those individuals. Otherwise, breast MRI is not for everyone. Mammogram and ultrasound is able to diagnose up to like 99% of the breast cancers, and we do not need breast MRI for that.
So from the indeterminate, you've taken me to malignant and benign. What are those?
So benign lesions are ones that can be in the breast. They would grow very slowly and they will not go to other sites. Malignant lesions are fast growing. They have very fast doubling time, and then they can go to the brain, the bone, some go to the liver, the spleen, in fact, any other part of the body. So basically, when we say we want to catch cancer early, if it starts in the breast, we want to be able to get it out of the breast and out of the body before it gets to other parts of the body. Because once it starts metastasizing, it means the person is getting to the end of life. And that is the sad thing, because most of our cancers are being diagnosed in stage 3 and stage 4, where they have very bad survival, low survival rates compared to other countries that have real screening protocols. So they are able to pick up cancers in stage 1, where they are having like a 90% 5-year survival rate, compared to somebody coming in stage 3 or stage 4. In fact, some come in with breast cancer. They know there's something in their breast, but because it's not painful, they do nothing about it till they become paralyzed. So the first time you might see somebody for breast cancer. The person is paralyzed, had a mass in the breast for more than 3 years. It's not painful, so had done nothing about it, and they are coming in paralyzed. Which means that the cancer has moved from the breast to the backbone.
Yeah.
And now they are paralyzed. Then they are feeling pain. They can't walk, so they'll come to the hospital.
So I'm getting a trend here that even though cancer prevalence in Africa is lower than in the West, because they are able to investigate and find out these cases very early, they are able to treat. So mortality is low. But for us, sometimes we do not get to find these cancers early. So by the time we see them, they are at stage 3, stage 4, and it becomes very fatal for patients. Is that the trend you're also seeing?
Okay, so half of what you said is true.
Mm-hmm.
The thing is, they are not coming to the hospital. So it's not like you do not have the tools to diagnose.
Okay.
But, oh, it's in my breast. It's not even paining me. I don't have a problem with it. There was a time I was reporting a chest x-ray for somebody who was doing medicals to travel outside to study. And then I saw a mass. So I called the doctor and said, your patient has cancer somewhere. This is metastasis. So the doctor started questioning the patient and she said, oh, I have something in my breast. It's not even painful. It's not paining me. But as she's sitting there, planning to travel outside to go to university, she has breast cancer that has left the breast and have gone into the lung and is growing, because as at the time we saw it, it was about 4 centimeters. It's big. So she knows there's something in her breast. She is not that she doesn't have money, but because it's not paining her, she's not even bothered about it and will not even go to the hospital for anybody to tell them it's this or it's that. But so she would have just been there, and then the lung metastasis would have been there. Then she'll start having symptoms of breathlessness. That is the time she would have been diagnosed. So she've had this thing, but has decided not to go. Our problem is the time of seeing the problem and then time to report to the hospital. So it's not like there aren't investigative tools that can be used to diagnose these, but what time are we getting to the hospital? That's the question.
This is the Super Morning Show. It's our Cancer Awareness Month. My name is Kojo Akoto Boateng, and our guest for this episode is Dr. Albertina Williams. She's a consultant radiologist, and she's a women and breast imaging specialist and a breast interventionist. And she's talking to us about investigative tools for cancer diagnosis. You know, modern cancer diagnosis involves sophisticated tools and techniques that many of us don't understand. So this episode, we are trying to demystify the diagnostic process, okay? We are trying to explain how doctors use various tests to detect and confirm cancer. And also trying to understand how to reduce the fear of going for a test and to help you know what to expect if you need testing. And Doctor is so far has explained a lot of things to us. So, Doc, you said that there are imaging techniques like CT scans, MRI scans, PET scans, and ultrasound scans.
So for the machines we use for the breast is the mammogram, the breast ultrasound, and then the breast MRI.
Okay.
But we also try to stage the disease to see if it has spread to the other parts of the body. That's when we use CT scans, bone scans, PET scans, so that we'll be able to plan the treatment as to what surgery, the kind of chemotherapy, or if the patient will even undergo radiotherapy. So after the diagnosis of cancer by a mammogram, a breast ultrasound, or breast MRI, we go on to do biopsy. Usually what I do is ultrasound guided core biopsy, where we use ultrasound as a means of getting to the cancer and then taking pieces of it to send to the pathologist for them to be able to tell us what it is. If it's found out that it is breast cancer, then they do the hormone receptor test, which is the ER and PR. We also do the HER2 new test and then some genetic testing if it's indicated.
Doc, you've also mentioned biopsy. So today
Yes.
we're having a mini medical school on the radio. What's a biopsy?
So biopsy is taking pieces of a mass to send to the pathologist for definitive diagnosis. There are more than 600 subtypes of breast cancer. So what Ya might be having will be different from what Efia is having. Though they might be having the same symptoms, the kind of chemotherapy choices that the medicines that will be used might be different. So we have to know the biopsy gives us a piece of the tissue. We get it out of the body, understand how it's like. Then after we have all this, we have a multidisciplinary team where people from different, like we have surgeons, pathologists, radiologists, there are nurses, there are palliative doctors, we have breast surgeons, what's their name? Psychologists, because it's a big team. Yes, nutritionists. We have oncology nurses that would sit down and then decide per patient. Everyone is unique, just as your name is unique. So we pick person, look at the size of the lesion. Has it spread? Has it gone this way? That the person still want to give birth after this because the person had not given birth before, or the person doesn't bother about it. Is the person pregnant? So we sit down and discuss the patient and choose the best treatment plan. But the problem is most of the time our cases default.
Why does it happen that way? Why do cases default?
Oh, well, some of them would say they have prayed about it and it's gone and it will go on itself, or they are going for waiting. Some will say they are going to see a malam. Some will say they are going to see a prophet. And some are just afraid. And some also just give up on life.
Wow.
If you catch cancer early, the treatment is cheaper than if it's coming in an advanced stage.
Is the treatment painful?
Oh, well, cancer is aggressive. So whatever drugs you are using also has to be aggressive. So it kind of weakens a little. But hey, there are people that have gone through breast cancer. If they tell you this person has gone through this, you wouldn't believe it. You have to just be stronger than the cancer.
How about the investigation process, the diagnostics process? Is it also painful?
No, when I'm doing biopsy for patients, sometimes I play their favorite music or we chat through the procedure. I wouldn't say it's painful. No, not at all. Well, when I am doing it, I wouldn't say it's painful because I try to feel the person's pain.
I'm wondering some of the songs the patients have been asking you to play. What are some of the high-ranking musicians whose music you play for patients?
All of it end up being gospel.
I see. Interesting. This is the Cancer Awareness Month, and we are talking about investigative tools in diagnosing cancer here in Ghana. And our guest, Dr. Albertina Williams, is sharing a lot of them with us. But Doc, you've spoken extensively about breast cancer and the various tools and the various processes, and you've given us some of the nuances behind all this. People who don't consistently come for treatment and follow-ups and all those things. The processes you use in diagnosing breast cancer, is it the same for all the other types of cancers we've learned about so far? For example, men have prostate cancer. There are the cancer in the bone marrow. What's it called? I learned about it yesterday, but the name is gone. Leukemia. And all the other types of cancers. Is it the same process you use in the diagnostic process?
No. For leukemia like this, if they are going to use imaging, that would be bone, it's bone. So that would be X-rays, CT scans, or MRI of the particular parts that they think the leukemia is. And then they'll do blood tests. Sometimes they do bone marrow biopsy, where they go into the bone marrow itself and then take a piece of it. If it's liver cancer, in fact, liver cancer, we don't talk about it much, but let me tell you how deadly it is, just a bit of it.
Okay.
For the 2,800 cases of liver cancers that are diagnosed yearly,
In Ghana,
2,000, yes,
2,800 cases.
yes, it's a lot now. 2,400 die because within 6 weeks, latest 8 weeks, most of them are dead. If you are not doing screening and you are waiting for the thing to happen before you go to the hospital for treatment, it means about 70 or 80% of the liver is already gone. Okay, so let's forget about liver cancer.
No, Doc. Let's hold on to liver cancer for a bit. You said we have about 2,800 cases every year, and about 2,400 of them die. That is 85% of them dying every year. So we lose.
They come in late, and people are drinking indiscriminately. There's hepatitis, people with hepatitis B infection. Some of them do not even test, so they do not even know that they are hepatitis B patients. And by the time you realize, they'll be coming with these huge masses. And most of the time, when these things start, it starts with general malaise, and their eyes are yellow, and we like over-the-counter drugs and herbal medications. So the liver that is already weak, they would go and take different herbal concoctions, be drinking it in cups and glasses, and then weaken the liver further.
Wow.
So it's and what you can do is to have an ultrasound for the liver. It's an ultrasound, and then be sure if you are Hep B negative, you get the vaccination so that you don't get the infection, because most of these people have the Hep B infections. And
Wow.
still, in fact, let's say for the liver, the person would not even know. But for the breast mass that they sit down and even look at, they don't want to go to the hospital because it's not painful. So,
We have a lot of work to do. So you've given us a lot on breast cancer, on leukemia, on liver cancer. Now, whilst we talk about breast cancer for the women, the men are also suffering from prostate cancers. These days, when I meet my older friends who are 50, 55, 60 years, and they're having conversations, the prostate comes up in almost every 15 minutes. Somebody mentions something about prostate. Tell me about it.
okay, so for the prostate, what the men can do for themselves is to eat well, exercise, make sure you have enough fruits and vegetables, and do yearly PSA testing, which is the prostatic specific antigen. That there are levels for it depending on how it is. Then they can tell whether the person has prostate cancer. Then they can go ahead and even have prostate biopsies to be able to diagnose these. But a lot of men you don't like going to the hospital. You have a few coming in, which is great, but most people are not thinking in that aspects. They want the disease to come before we do something about it. We are not being proactive.
And
We
how
are
is the
not
diagnosis for prostate done?
we do PSA testing. It's a blood test. And
So you don't
then
use your imaging machines.
you can do a transrectal ultrasound or have a prostate MRI. But we usually do the prostate MRI after they have high PSA, and then they might have done a prostatic biopsy. Then they come in for the prostate MRI.
So it means that for every patient, sometimes you'd have to do multiple tests to really establish what it is, how advanced it is, and the course of treatment for it, right?
Yes, because you want to stage it. There are different stages of the disease. The treatments that you do for stage 1 is different from what you do for stage 4. Currently, they are still doing tests on how to be able to treat breast cancer that is less than 2 centimeters with cryotherapy, where they are freezing the cancer. So if somebody comes in and the person has a 1 centimeter breast cancer, you just put the probe, just like you are doing under ultrasound, just like we are doing a biopsy, put it in the middle of the cancer and then freeze it. But if people are going to wait till the cancer has taken over all of the breast and has even spread to the bone and everything, there's absolutely nothing you can do about it. So staging is very important because it can determine what we can do for this patient. For some, you just have to give them palliative care because they are coming in advanced stage. In the early stages, we want to take out the cancer from the breast, and then every part of the body should be free. We don't want it to spread. But if the person comes and it has already spread, then you give there are treatments that we also give that some of them are like respond. There are some people that are miracle patients. They will come very bad. You start treating them and they somehow get somehow better. Yeah.
Now, Doc, let's spend the last 5 minutes of our conversation talking about some of the other things that I have read about today and
So-
also heard over the past few days. For example, the Ghana Health Service is running an ad on our show, and they're talking to women to go for, is it for I've forgotten the name of that vaccine. They should vaccinate again so that they reduce their risk of getting cervical cancer.
Yeah, that's the HPV.
HPV, yes. And my niece and a few female friends I know over the past few days have been talking about going to get the pap smear and all those things. Can you tell us a bit about those?
Okay, so cervical cancer is cancer that affects the cervical region of the uterus, and the human papilloma virus, which is the HPV, has been implicated in more than 90% of the cases. So it's like if someone has the HPV, they are likely to have cervical cancer. So what they are trying to do with the vaccine is to be able to prevent the HPV infection, and in the long run, being able to decrease the number of cases of cervical cancer that we have in our community. So if the person is a virgin, that is the best time to receive the vaccine. If the person is sexually active, then it's important to have yearly pap smears, where it is quite it's uncomfortable, but it's not painful. And in that, you put a speculum into the vagina and then swap it around there's a particular swap that comes that we turn around the cervix, and that we send to the pathologists for them to tell us whether there are cancer cells in there or not. And
Is it like the swab they use for COVID testing?
no, this
Okay.
this one has it's a wooden spatula, really, and it has a shape that fits into the cervix of the female.
So you would recommend that all our daughters, our sisters, our wives.
No. The person is not sexually active.
Mhm.
You will not even do it for such a person.
Okay.
So it has
Okay.
to be somebody who is sexually active.
Now, Doc, let's come to one of the most important areas when it comes to testing. Is it expensive to test for any of these cancers? One, you've established that when it comes to the diagnostic tools, we have all of them available in Ghana. But how
Yes.
affordable and how accessible are they?
They are affordable and accessible. I was telling someone that for October, that is when most of the mammograms machines in the country is being used. And for the rest of the year, it's free. It's just there. Nobody uses it. So it's not even about the numbers, because for what we even have, it's not overwhelmed. It only gets overwhelmed in October and then the early part of November, and it's like everything goes to sleep again. It goes into hibernation till October, like we having this talk that would encourage someone to go and have a testing. These things are there, but we don't want to assess it. I don't want to know. What you don't know don't kill you, but that's not true when it comes to your health.
And they're accessible across the country? Like if I leave Accra and go to Kumasi, and I leave Kumasi and go to maybe the Gary Timpani district, for example, and if I'm a woman, can I have access to these services?
At Accra, you can get Kumasi, you can get, but for the other regions, they'll have to come to the regional capital. And let me tell you,
Lots of work.
machines are even there. People do not really go for it. For some years, it might not be affordable, but then they would not even go and ask of the price.
Yeah.
There's nothing wrong with me. Why do you want me to go and check? Then you tell me I have this and I have that. That's what you get some people telling you that. It's something. But then the story changes when I have seen people just go for a test. Then the next year they go for another mammogram, and then there's an interval cancer. They are so.
So you don't have to wait till you feel pain. You don't have to wait till you feel that something is off.
If you're waiting to feel pain or feel that something is off, then you are gambling with your life.
Wow. Another question. You can land, then I'll give you my last but one question.
Bring your question.
Are these tests covered by health insurance?
I don't think so. I don't think so. For some of the ultrasounds, yes, it's covered by health insurance, but when it comes to mammograms and the rest, no. And we are still in the process of getting a national protocol for these things. Then, in fact, the Breast Society of Ghana, when we launched this year's campaign, we invited the NHIS over for us to have deliberations and then things that they should add to their list. And I think it's an ongoing conversation. We hope we get there someday.
Let me see if I've been a good student. Before we wrap up, many of us fear the diagnostic process itself, but we shouldn't fear because it is not painful and it's not something to fear, right? Because you have all the tools and the experience to do it. Proper diagnosis is crucial for effective treatment. So you do not have to wait and feel some pain or some discomfort before you go and test. Just talk to your doctor, and your doctor will advise you on regular testing for different cancers so that you can see whether you are okay or not, right?
Yeah.
And we have a lot of professionals in the treatment and the management chain who are ready to help us if, unfortunately, we have any cancer.
We are more than ready.
And early detection saves life.
Early detection and effective treatment saves lives.
Early detection and effective treatment saves life. Doc, you've been amazing. on this episode of the Joy FM Cancer Awareness Month. Dr. Albertina Williams, consultant radiologist. She's also a women and breast imaging specialist and a breast interventionist, talking to us about how we diagnose cancers, the various investigative tools, and what we can do together to detect early, treat early, so that we can save our lives. Any final words, Doc?
Most of the diagnostic centers in and around the country are offering amazing discounts, and I think this is certainly a time of the year that every woman should go for a mammogram. If you're above 40, if you're less than 40, you can go for a breast ultrasound. And please, for the men, the 1% of them that has breast cancer, I beg you, don't stay in the house like the women do. Come early so that it will be sorted out early.
And we'll be coming to BME Diagnostics and Healthcare at Abelikuma Pentecost Junction. Thank you so much, Doc. And thank you to our listeners for listening. The Super Morning Show continues. Stay with us.